You're listening to Soundside. I'm Paige Browning. These days, people are using artificial intelligent chatbots for everything. What am I making for dinner? Claude has the answer. How do I respond to this email? ChatGPT can just write a response for me. And what should I do about this abdominal pain? Well, people are turning to chatbots for that too. Survey data from 2024 shows around 1 in 6 adults use AI chatbots for health information about once a month. These chatbots have a wealth of information at their metaphorical fingertips, but the accuracy of the information that they offer is, well, questionable. But it makes sense why some people turn to AI for medical advice. For one thing, they're usually free, an advantage when healthcare in the United States is so expensive. They're also easy to access, so people can get their questions answered immediately instead of waiting around for an opening at their doctor's office. And they are trained to be empathetic, which is especially appealing to patients who don't feel valued in medical settings. Today, we're going to explore the world of health advice and chatbots with two medical professionals. Dr. Angad Singh, a family medicine physician. He's an associate chief clinical information officer and clinical associate professor at UW Medicine. And Dr. Danielle Bitterman is an assistant professor at Harvard Medical School and clinical lead for data science and AI at Mass General Brigham. Thank you both for being here.
Thanks for having us.
Yeah, appreciate the opportunity.
Dr. Singh, I want to start with you. There's been quite a bit of coverage in recent years about people using AI chatbots to get their health advice. Is this something that you see in your practice?
Absolutely. I think the idea that the technology that underpins chatbots is new is probably a bit of a myth. It's been something that has been developed over years until it's become front and center in the public's mind in the last few years. Historically, we would say, did you ask Dr. Google? I'm an urgent care physician, so generally speaking, people come in with specific new complaints that they don't necessarily know the answer to what might be going on. And so a common question that I ask my patients is, what did you look up already? What research have you done? And that research may have included more of a quote simple Google search, and now it might include, I put this in ChatGPT, and this is some of the things it gave me. What do you think about it? So I think the conversation has gotten richer and maybe slightly different, but underpins the same things I've seen in my career in medicine so far.
That's interesting. I can speak for myself. I have not used one of these chatbots for medical advice, but for years I've been Googling or doing WebMD to just be the first line of defense for information. Dr. Bitterman, I want to bring you in. You researched chatbots and medical advice. What are some of your biggest takeaways from that research?
Sure, yeah. So my lab is focused on understanding how AI that processes language, it's known as natural language processing, but it's the field that kind of led to large language models, which are the AI models that underlie these new chatbots that are really good at being conversational and can seem really human-like. So we've found, positives and negatives of using these chatbots, not surprisingly. Early on, we showed that these models can answer, for example, basic questions about cancer treatment with at least one guideline concordant recommendation in the answer most of the time. But in about a third of cases, there was one non-concordant example, one incorrect treatment recommendation mixed in.
In a third of cases.
In a third of cases. Now, this was very early on. We did this right when ChatGPT came out. This is also what makes it hard to make recommendations about how to use these models. They are moving very fast, but they're not perfect. But yes, it was in a third of cases. And one thing that I think is important and still a challenge today is that even if the rate of error might be lower, the way these models provide information is very human-like, as I had mentioned, but also very and convincing in a way that's hard for even experts in some cases to identify. And if it's then on patients or users who don't have a clinical background, it's even harder to identify when something might be incorrect. So the safest thing is to always confirm any information with your physician and not directly act on any information that you get from these chatbots.
Dr. Singh, people are sharing medical records, their own medical information with chatbots. I've seen this recommended some places. The thought is if I'm sharing my own medical information, it's going to give more personal answers to me. Dr. Singh, Is that a good idea?
Yeah, I would say it depends who you ask. I think that in general, there's a lot of steps that go into deciding whether, quote, that's a good idea. So you may have seen the recent news that ChatGPT released ChatGPT Health, which is supposed to be a bit of a cordoned off area where you can link specific aspects of your health records, or perhaps an app that you use, a fitness tracking app that you could have it pull in that data to provide a more rich ecosystem of data to pull from and a richer ecosystem of data to, or outputs to suggest. So if you have certain medical conditions, it might say, oh, I know you use this app. In this app, you should track these features as an example. However, I think that the reality of it is it's not quite clear that that data is necessarily something you can't trust to be incorporated and be public. Now, on the surface, ChatGPT Health says that we don't use your data in ChatGPT in this particular area to train our foundation models. What it's not necessarily clarifying to me is it using it to update ChatGPT Health? How is it utilizing that to actually make those responses more useful and better over time? And so, in general, if somebody were to share their health information, we do suggest de-identifying it as best as possible, recognizing that even having a login or even going onto the website has already created a footprint for yourself. So that's still relatively imperfect. Um, but I think if you were to ask patients in communities that are navigating very complex medical issues, particularly chronic illnesses that span many, many years, span multiple health systems, potentially across geographic boundaries, or even within the same city, different health systems, you're asking GPT to synthesize complex data that a single human may not be able to do as readily. So if you're weighing the pros and cons of something being able to synthesize versus navigating this question of privacy and training, some patients have elected to put their data into ChatGPT, trusting that its terms of service will protect them in the long run, in hopes that their health will be net better. But I would say that the average person is maybe a little bit skeptical, understandably so, myself included. And I myself would not necessarily link my health records, but I can understand when you have a complex medical condition that there might be some value that people see, and it might be quite tempting to do that.
Dr. Singh, I very much agree with everything you just said, and it's a really complex and personal decision about whether you're going to share your data. And I think the most conservative thing is to assume that that data will not stay private because we don't really know. And the companies aren't HIPAA covered entities. They don't have the same legal requirements that your doctor does or your healthcare institution does. I very much agree that patients with complex, long clinical histories stand to benefit a lot from having assistance in navigating their medical records. It's important to keep in mind that oftentimes those records are fragmented over many different hospital systems, and a patient might not have the entirety of their records. And so if you upload it, there might be having some missing information in there does open a potential window for some error. So just something to keep in mind that I recommend patients keep in mind.
Oh, that's an interesting point where it might show, okay, here's my history in the last few years, which show I have this medical issue, this disorder, but you might not see the backstory of the signs that were leading up to this.
Yeah, like for example, so I'm a radiation oncologist, and oftentimes we have patients who got a course of radiation therapy when they were living in a different state, then come, move, and then we see them in clinic. We might not have their radiation records. So we have to be thoughtful to ask the patient, did you have radiation? Because you can't, you have to be aware of how much radiation dose someone got to safely treat them the next time. If ChatGPT doesn't have the records from that initial one and you're having, the same conversation, it might not have that same awareness. And so the treatment recommendations might be in the context of thinking you didn't have that prior treatment. It's just very, it's the way that healthcare data are collected generally makes it hard to be able to provide chatbots complete clinical context.
There are a lot of things chatbots can do. They quickly aggregate that information and they immediately adjust their emotional responses, which is an interesting part. Dr. Singh, I wanted to ask you, what are some things these chatbots cannot do? Where do they fall short compared to what a patient would get at a doctor's office?
I think the number one thing that I've seen as a limitation is an appropriate conversational style that would clarify additional symptoms that might not come up on their own. So as a patient, I'm saying that I'm having chest pain. As a physician, I have a long list of questions that I need to ask. Where is it hurting? How long has it been going? What other symptoms are you having? Does it get worse with exercise? How about when you're lying flat versus sitting up? And we try to navigate a diversity, what we call a differential diagnosis. They're all a laundry list of options that could be explaining why you're feeling the way you are. And what we find, at least in my experience with chatbots, is that set of questioning often is quite narrow and jumps to a conclusion perhaps faster than somebody might in a role as a physician for that patient. So to me, that element of thinking broad is a limitation that I think most patients would unfortunately experience.
Hmm. Dr. Bitterman, if you'd like to add anything.
Yeah, no, I agree. And I think this is very, similar, but just different ways to describe a symptom or different ordering of symptoms that you put into a model might lead the model to provide different output. The other thing I wanted to add is there's a lot more. This is not unique to medicine, but there's a lot more to communication than just text and language. And especially though in healthcare, the therapeutic relationship in these sensitive situations is really important for trust and motivation for health change and behavior change. So when we see patients, we see first how they're doing. We get clinical gestalt based on how they look, how their voice sounds, how they walk. And chatbots, by definition, don't have that ability. And so they can't take those clinical nuances into account in the same way. And those really do weigh into our treatment decisions. As a cancer doctor, if I see someone come in who's frail and not doing well, I take that into consideration when thinking about is it going to be safe to treat them aggressively or not? And, these types of clinical gestalt are important to medicine and hard for models to capture.
Okay, we're going to pause for just a minute here. You're listening to Soundside. I'm Libby Dankman, and you're hearing a conversation that my KUOW colleague, Paige Browning, had with Dr. Angad Singh, a family medicine physician and Associate Chief Clinical Information Officer at UW Medicine, and Dr. Danielle Bitterman, an assistant professor at Harvard Medical School and clinical lead for data science and AI at Mass General Brigham. And they're talking about the growing trend of people using AI chatbots for health advice and what patients should know. We're going to hear more of that conversation after we take a quick break on KUOW. Welcome back to Soundside. I'm Libby Dankman. AI tools are making their way into our everyday lives more and more. But should you be trusting AI with medical advice? Right now, we're listening to an interview that KUOW's Paige Browning did with two doctors about what patients should know about using chatbots for their health questions. And she sat down with Dr. Danielle Bitterman, an assistant professor at Harvard Medical School and clinical lead for data science and AI at Mass General Brigham, and Dr. Angad Singh, a family medicine physician and Associate Chief Clinical Information Officer at UW Medicine here in Seattle. Let's get right back to that conversation.
A big part of this conversation revolves around the state of our healthcare system. Appointments can be expensive. It takes a long time to see a doctor sometimes. Artificial intelligence, on the other hand, it's free and it's available all the time. So for someone who doesn't have time or money or insurance to book that doctor's appointment every time they have a health question, ChatGPT could feel like a really good alternative. Dr. Bitterman, we've talked about the downsides of getting medical advice from chatbots. Are there upsides? Or are there more upsides we haven't talked about?
I think there may be upsides, but we need evidence that high quality evidence that the answers are safe and support patients' education and information in the real world. So I see huge potential. What I worry about is that they're being used a bit too early and there's going to be a major error and set back the field so that we won't see the huge potential.
Dr. Singh, what sort of upsides are you seeing for patients using chatbots?
Absolutely. I think there's two aspects that are really quite valuable. One with I just call it a translator, right? You take often medically complex reports or documentation or concepts that took Dr. Bitterman and I, months and years in medical school and training to understand the depths of. And we have to present that to patients in a matter of a few succinct documents. So it can translate medical jargon into plain English text that can open up the early stages of understanding for our patients. So it may not be perfect, but if I can understand in high level the general questions that are being kind of considered here, I can bring that to my doctor and get into the next layer of questioning so that I further understand my own health and the health needs and the treatment options and try to understand how I can make a better decision for myself, given my values, given my priorities, given my medical comorbidities or medical issues that I have.
Sort of seeing it as another tool in the tool belt, I guess, in a way. There's also been a lot of talk about how these chatbots can be quite empathetic, maybe to a fault even. Dr. Singh, when you hear that patients may feel more comfortable talking to a chatbot than their own doctor, how do you respond to that?
I think it's important to understand that chatbots use emotional words, but not necessarily emotions. Right? They use empathetic words, but aren't necessarily empathic. When a patient comes to me, they have the full experience, meaning they have visual experience, they have auditory experience, and they can see both my body language and my nonverbal language as well. And that orients somebody to the empathy that I provide as a physician. Something simple as sarcasm as a form of humor, when written down, may not translate quite the same way when run through a chatbot, because sarcasm by the nature is meant to be a bit absurd. So if you had somebody who took 100% of things at face value, just for the words that were spoken, the challenge that happens is that it isn't quite going to meet the needs. Now, what we recognize is we have a tension between how much time do I have as a physician to apply my skills and training and my own empathic approach versus how much time and space does the patient desire. And there's often a mismatch there. So if I want more long form answers that kind of help me explore some of the nuances, that may be where it appears that chatbots are able to do that by producing stuff in long form in a shorter amount of time. However, on the physician side, when you are navigating a complex, busy medical practice, sometimes you have to pick and choose when you can spend the time to provide lengthier answers and in what medium. And that's where the tension is often there for me. So I would argue that both are empathic, but the constraints are different. And so in that way, there are definitely moments where people might feel like chatbots are more empathic, but my experience is really that it's good in certain cases in relatively unidimensional settings.
I do want to hear this is an imperfect system, to say the least. I want to hear tips that both of you have for people who do turn to AI for health advice. Dr. Singh, I could start with you.
The first thing is you need to know why you're going to the chatbot in the first place. It may not be the best at identifying your diagnosis. You always have to use independent critical reasoning whenever you're looking at the output of it. You always have to approach it with a bit of skepticism. And you always have to validate it against typically the support of a medical professional in many cases. So if, the headline here is that some people are saying is Dr. Google better than Dr. ChatGPT? AKA, is the usual means of what we've historically done better than what we're doing today? And that's an interesting question. So first off is knowing that. And the piece of it is, I mentioned before, it can be an excellent health coach. So where I suggest doing stuff, for example, if I have a patient who's pregnant, who I'm talking about a birth plan, they might say, I have no idea what a birth plan means. I hear this word all the time. And ChatGPT is a great resource to say, can you show me what an example birth plan is and what are the components of that? I'm more informed to understand the variables that go into this kind of a discussion that I need to have with my doctor. Or I've had patients come to me and say, these are all of the things that are on my mind, and I need to organize it into a succinct kind of a agenda for myself. So when I come into the doctor's office, I'm prepared and know which details pertain to which topic so I can be maximally effective in my communication with my doctor. That's quite helpful as a health coach. And so to me, the first thing is knowing why you're using it, understanding that it may actually not be better. You may not know how to use it actually as well as you think you do, and that you really need to make sure you're approaching it with that lens of a critical eye.
Yeah, that is so interesting. I'm hearing if you are seeking a diagnosis, very clearly a medical professional is going to give a more accurate diagnosis. If you're seeking a specific tool that you already know you need, it can be a great resource for that. I want to get your tips also, Dr. Bitterman. What do you recommend?
Yeah, and I have to say I very much agree. I was with what Dr. Singh just said. So I think using it really for educational, informational purposes in situations where you can always, where there is time to go and discuss it with your healthcare provider. Another interesting finding from that study was that the models struggle with determining, they might know what the diagnosis is, but they struggle with determining the urgency of the situation. That's something that clinicians we learn during our training, and it's not present just out there in textbooks that the models can be trained on. So in situations where you think there might be urgency, any medical emergency, call 911, do not rely on a chatbot.
One more question for you two before we go. AI chatbots have illuminated some flaws in our healthcare system that we've known about for a long time, like cost and inaccessibility. For both of you, do you think the growing popularity of these chatbots could force us to have some more serious conversations about the state of our healthcare?
I think absolutely. I think the huge interest in using these chatbots signifies people need better means to access health information and access healthcare. And I think it already is starting to illuminate. We're seeing more federally funded initiatives to expand technology and improve technology for access. So I do think it's highlighting and driving conversation in that way. Um, as to like the question of is using ChatGPT Health free? I'm not sure I would say it's free. Yes, it doesn't cost users, but OpenAI is a company and they are offering this for a reason. They are getting value out of the questions you're putting in and out of the healthcare data you're providing into the into the chatbot, and it's important to keep that in, and that needs to be kept in mind. It's not completely free.
These are run by corporations in a capitalist system. Dr. Singh, jump in here.
There's a common saying, if you're not paying for the product, you are the product. And that applies here too. And the funny part of this is even if you're paying for the product, you probably still are the product. And that's what is actually extra interesting here.
Dr. Danielle Bitterman is an assistant professor at Harvard Medical School and a clinical lead for data science and AI at Mass General Brigham. And Dr. Angad Singh is a family medicine physician, and he's also an associate chief clinical information officer and clinical associate professor at UW Medicine. Thank you both so much for being here.
Thank you. This was a really interesting discussion. Thanks for having me.
Yeah, very engaging conversation.
Thanks for listening to Soundside. Don't forget you can listen live on KUOW 94.9 Seattle at noon and 8 p.m. Monday through Thursday, or anytime right here online at KUOW.org, or of course on your favorite podcast app.